I am Dr. Danielle Hines at Russell Ridge Animal Hospital, and today I would like to help you better understand cat dermatology. The most common skin condition in cats by far is flea allergy dermatitis. This is easily prevented with routine flea and tick control. The next most common thing that we see is self-trauma and over-grooming, sometimes due to allergies or anxiety. While we do see ringworm in young kittens, it's not as common in adult cats as a lot of people think. You don't necessarily need to see a specialist if your cat has skin issues. The most common skin conditions in cats are caused by underlying issues such as allergies or anxiety, which can be treated by your regular veterinarian. If your vet thinks that additional testing or specialist treatment are indicated, they can help you set up a referral to a dermatologist. If you notice any kind of skin lump or tumor on your cat, you should make an appointment with your veterinarian immediately. While skin cancers are not very common in cats, this should be ruled out. Lumps can also indicate things like infection or inflammation. Your vet can do in-house diagnostics such as a cytology, which is looking at a small sample of the lump under a microscope to determine what the best treatment is. The most common cause of itching, scratching, or excessive licking and grooming in cats is flea allergies. Because cats are such fastidious groomers, they can be suffering from flea allergies without obvious evidence of live fleas on their skin. Other environmental or food allergies can cause itchiness in cats, but they're a lot less common. Dermatitis is any kind of inflammation in the skin and can occur with or without a secondary infection. Your veterinarian will diagnose this based on physical exam and may take some small impression samples of the skin to look at under the microscope to rule out whether or not infection is present. Skin infection can present in a variety of ways, such as hair loss, rash, crusting, or hot spots. Skin infections in cats are almost always secondary to some underlying issue, which needs to be addressed to prevent recurrence of the infection. Your veterinarian may diagnose a skin infection based on physical exam alone. In some cases, they may perform a cytology, which is when a small sample, either a skin scraping or impression smear of the skin, is evaluated under the microscope to determine what type of infection is present. In severe cases, or when antibiotic resistance is suspected, your veterinarian may submit a sample to the lab for a culture. This is when that sample of bacteria is grown on a petri dish and then submitted to antibiotic testing to determine the best type of treatment. Signs of skin allergies in cats can range anywhere from a slight increase in grooming behavior to hair loss to widespread dermatitis or skin infection. Symptoms of skin allergies can often mimic other types of skin conditions, so it's best to consult with your veterinarian before assuming your cat has allergies. Treatment of skin conditions in cats depends on the diagnosis and should be discussed with your veterinarian. We have many different options for treating allergies and other types of skin conditions, and your veterinarian can help you develop the plan that is best for your individual cat. Food allergies are not very common in cats, but do occur in a small percentage of patients. Poor nutrition can also lead to symptoms like dry skin and a dull coat. However, most commercially available foods meeting AAFCO minimum standards should provide plenty of essential nutrients to keep your cat's skin and coat healthy and strong. Demodex and Sarcoptes, also known as mange, mites, or scabies, are pretty rare in normal adult cats with healthy immune systems. We do see these parasites occasionally in young kittens or adult cats whose immune systems are compromised due to stress or other illness. However, if you see symptoms such as hair loss, itching, or scratching in an otherwise healthy adult cat, Some other issue like allergies or fleas is much more likely than mange. The most common sign of flea allergy dermatitis in cats is excessive grooming, licking, and chewing around the lower back, the base of the tail, and around the face and ears. We often also see a scabby, bumpy rash over the back and neck called miliary dermatitis. Since cats are such fastidious groomers, they often remove live fleas without the live flea ever being seen by the owner. However, your veterinarian can usually find evidence of fleas on a thorough physical exam. There are many products available to safely and effectively prevent fleas and ticks in cats. Here at Georgia Veterinary Associates, we primarily recommend Revolution Plus, which also prevents heartworms and intestinal parasites. In general, prescription parasite preventions are safer and more effective than over-the-counter generic products. It's very important to never use a product labeled for dogs to treat fleas in your cat, as products labeled for dogs can cause severe, life-threatening reactions in some cats. Hair loss in cats can be caused by many different issues, but allergies and overgrooming due to anxiety are the most common causes. If you notice hair loss or bald patches on your cat, you should schedule an appointment with your veterinarian as soon as possible for appropriate treatment recommendations. If your veterinarian has ruled out allergies or other skin conditions, an omega-3 fatty acid supplement, such as fish oil, can be used to help treat dry skin in cats. Typically, topical products are not recommended for cats as they are likely to groom these products off quickly, which could cause GI upset or even toxicity. Most cats never require a bath. Their natural grooming behavior effectively cleans their fur and distributes the oils needed to keep skin healthy. Cats with medium and long fur do require regular brushing to prevent mats and maintain skin health. Owners of cats with longer hair often choose to have their cats groomed a few times a year and shave the coat down to reduce matting and reduce shedding. Hot spots are typically areas of deep skin infection or moist dermatitis. If you notice a hot spot on your cat, you should schedule an appointment with your veterinarian immediately for appropriate treatment and antibiotics. Generally, topical treatments and medications are not effective in cats due to their grooming behavior, and some topicals can cause GI upset or toxicity if ingested through grooming. Antihistamines such as Benadryl are not typically effective at reducing skin itch in cats. Caution should always be exercised when administering any over-the-counter medication to your cat. It's best to check with your veterinarian first. If you have any questions about your cat's skin health, please feel free to give us a call. We're here to help.